Hello, I am Dr. Ritika Goyal. I am a pediatric pulmonologist and an allergy specialist. As a pediatric pulmonologist, I mainly cater to children's lung diseases and allergic diseases that are rampant in the pediatric population. So, children are not tiny adults. They are tiny humans, but they differ a lot from the adult population in terms of their body functions, their systems, their ability to fight infections, and most importantly, the type of lung diseases that they suffer from. Since their lung diseases are very different, they need special care from experts who are trained in pediatric pulmonology. As pediatric pulmonologists, we take care of children suffering from diseases like pediatric asthma, tuberculosis, allergic rhinitis, bronchiectasis, cystic fibrosis, congenital lung problems, and other diseases like empyema and GERD. For all these diseases that I've just mentioned, children need specialized care at specialized centers by the experts in this particular field. Some of the other aspects of pediatric pulmonology that we specialize in are performing pediatric and neonatal bronchoscopies. With the help of bronchoscopy, we are able to diagnose airway obstructions. We are able to remove foreign bodies that are lodged in the airway or even take biopsy samples. Some of the other procedures that we do as pediatric pulmonologists are supervised pulmonary function tests in children, skin prick tests, and giving immunotherapy to these children for allergic disorders, amongst various other services such as performing sleep studies and sweat chloride tests. If your child is suffering from recurrent cough, which is just not getting better, he has persistent cough lasting for more than 4 weeks, child with recurrent pneumonias who require hospital admission for the same, child who's diagnosed with asthma is on inhalers but is not getting better, any child who has wheezing which can be heard by the parents should be taken to a pediatric pulmonologist for a consult. Some of the other signs and symptoms that should be taken care of by a pediatric pulmonologist are vomiting, choking on feeds or any feeding difficulties, sleep problems, any type of allergic manifestation, whether it is on the skin like atopic dermatitis or allergic rhinitis, a child suffering from tuberculosis who is suspected to have drug-resistant TB or multi-drug-resistant TB, and any child who has a neuromuscular disease must be consulted with a pediatric pulmonologist for special care. If your child is suffering from any of these diseases mentioned here or has any of these symptoms, please feel free to contact us.